Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Isotope bone scanning. Isotope bone scanning is also done. Actually, it is done in cases of it is done to stage the cancers. That is, it is done to stage the kidney, that is renal cell carcinoma. It is used to stage the renal cell carcinoma and also the prostate cancer, because these renal cell carcinoma and prostate will metastasize to the uh, skeletons. So in order to know where the metastatic deposits are there in the skeleton, we can do this isotope bone scan.
thank you and thank you for watching.